right, good morning. This is Arizona. Out here today at Jordan Stables in Waddell, Arizona. And we're doing a maintenance adjustment on her. Just getting started. She's a little sick. You can see, I don't know if you can see, but she's got a little bit of a runny nose. So I'm gonna try to steer clear of that today and try to make her feel a little bit better. She is a 7-year-old barrel racing mare, and she gets adjusted on a maintenance schedule. So I'm just out here to check her and just see what's going on, see if she needs any adjusting, and I'm just going to get started on her. When I start an adjustment, I like to just take a little bit of time and get them comfortable. When you haven't seen them for a few months, and I haven't seen her for a little bit, sometimes they can forget what you did the last time. So I just like to spend a couple minutes getting them warmed up and then start with the hind end. So I'm going to evaluate her pelvis first, see how she's moving through her SI joints, see if she's comfortable laterally flexing left and right. And, I'm going to do some pressure points back there, get her to flex and extend in the hind end, and just see how she's feeling back there. So if you have any questions or comments while I'm working, please feel free to type them in there, and I'll come back to the screen and check on them as I'm working. Don't have my mic today, so I'll be just coming up to the camera and just walking you through what I do when I'm done with it and letting you know what I find. But I hope you guys are having a good week. Happy Tuesday, and I'm going to get started on her. Let's spin her around so you can see a little bit better. So you can see she's dancing around a little bit, not too sure. So I just take it easy with them, go slow at first, get them comfortable, not try to force them to do anything until they're ready. And right off the bat, I can feel that she's a little bit high on this left side SI joint. But sometimes the what's called the PSIS, or the posterior superior iliac spines, can be asymmetrical. So when I'm doing static palpation like this, I'm just trying to get an idea for what the pelvis might be doing and what the position of the SI joints might be. This is just a general scan just to see how they feel, but then I have to palpate the joints and actually see how they're moving. Because if I have an asymmetrical pelvic spine on this side, so maybe this side's bigger than this side, and I go to adjust it, but the movement was fine, then I just did nothing. I might have actually made her worse. So I want to check motion and see how this is feeling before I get in there and start adjusting anything. So just looking at the pelvis, or just statically palpating the pelvis like this, only gives you a general idea. It doesn't actually tell you what's going on. So if somebody ever comes up and looks at your horse, right? You have a chiropractor come out and they just look at your horse and they go, "Oh, your horse looks fine. I don't think anything needs to be adjusted." That's a huge red flag. So you can't just look at them from a static position like this to determine if they need to be adjusted or not. Thank you guys for the comments. I see them popping up there. I can't read them from here, but I will check them in just a moment, and I will reply as soon as I can. So this is what I like to call dynamic spinal mobilization. I'm going to just take it off real quick. I think those guys got her a little riled up. So this is just a broad evaluation of how her spine and pelvis are moving. So you can see how I'm just nice and easily rocking her like this. And I'm using my top hand to go all the way up her back, all the way to the wither, and make sure that I'm feeling the spinous processes rotate as I'm moving her pelvis. And the longer I do that, the more movement she should give me. And a lot of times when you just do this, you'll get some pretty significant releases without having to put in a whole lot of force. Oh. So a lot of times when you do this spinal mobilization like this, they'll stand here and lick their lips and get nice and relaxed. You can see she's a little bit high strung, and I think the jets might have set her off a little bit too. Good girl. Hey. Oh, stand still. Stop. Stop. Okay. So I think she was getting a little bit, oh. She is a mare, so sometimes they test you like that. No, she's not pregnant. She's just a little bit plump. Thank you, Lee. Appreciate that. Deborah. Oh, thanks, Deborah. Glad you enjoy it. Yeah, thank you guys. If you guys don't mind hitting that like button for me, I'd greatly appreciate it. All right. So like I was saying, this is just a way to nicely mobilize the spine. And I know you can't see it at the moment, but she's standing nice and still, so I don't want to move her. But all I'm doing is grabbing her at the root of her tail and just very gently pulling her towards me. And you can see that I'm rocking my body to do this. I'm using my body, my larger muscle groups, to move her around. I'm not grabbing and just yanking her around with my arm. So try to do everything as comfortably as I can for them, and just make sure that they know that I'm not going to do anything to hurt them. And we go. Yeah, she definitely is a little bit high on this SI joint, and she's not moving as easily to this side as she was to that side. So I'm gonna do an extension adjustment on this side of her pelvis and see if I can't free this up a little bit. Thank you for the likes, you guys. And I'm gonna do a little bit of a pressure point on this side. So I'm gonna get her to drop her pelvis down and forward. We're back. Sorry about that, guys. I'm out kind of in a rural area, so she gave us a head shake, started licking her lips a little bit, standing here nice and comfortably. So that's what I like to see. She's a sweetheart. She's just a little unsure. So we got the extension pressure points. I'm going to do a flexion pressure point to try to bring her pelvis down and back and watch her back come up. That's just another way to check her SI joints and also to check her mid to low back to see if she's comfortable in flexion. Now, some horses get a little bit squirrely with the pressure points, like she seems to be. But you just try it a couple times, and hopefully they'll settle down and let you do it. And if not, you just go on to the next thing. But you want to try to make everything as comfortable as possible. So she is definitely a little bit tight in her mid-back. So I'm going to work on that a little bit, and I'm going to use a pressure point under her sternum that will get her to round her back out. So I really want to try to get this mid-back loosened up, because even when I was doing lateral flexion of the pelvis, I could feel that she was a little bit stiff in that mid-back. And because of that SI joint rotation on the left side, that's going to result in some tight muscles, especially on the left side of the wither. So I'm going to have to work those out and try to get them loose a little bit. Hey Mandy, I'm out in Santan Valley as well. I'm based out of Santan Valley, actually. Her name is Arizona. There we go. Good girl. And she is a 10-year-old barrel horse, 7-year-old barrel horse. Definitely have some tightness on the right side of her wither, actually. I thought it would be more on the left, but it's actually on the right. So I'm going to get her to come around with some pressure points. I'm going to have her come around and try to touch her shoulders and see if I can get the withers to loosen up in rotation. Oh, there we go. That was great. And we got a really nice release in her lower neck with that one too. Thank you, R Pillar, appreciate it. If you guys have any questions or comments, please let me know. I'll keep checking my messages as I'm rolling through the adjustment here. So I'm going to take her to the other side and see if she can touch on the other side just as well as she did to the left side. Oh, very nice, very nice. So that was really good. The one thing I didn't like was she threw her head up before she came around. So I'm going to do that one more time. Oh, oh. And you can see she's not really ready for that, so I'm going to reset. yeah. So definitely hesitation around to her right. There we go. So big adjustment there on the right side of her pole. So I'm just going to give her a minute. And then we'll recheck that pressure point. So I look for the head to come down, face to soften up, maybe some licking and chewing, a yawn, anything that tells me that she's more relaxed than she was prior to the adjustment. And I just wait for that to happen. And then once that happens, then I'll go on to the next thing. But I always give them time after an adjustment, there we go, to incorporate that. And then I'll go on to the next thing. So I never want to rush them. There we go. So you can see she's releasing, starting to relax a little bit. And then if you wait for them to be ready before you go on to the next thing, they'll start to allow you to do more and more. So it's just building that rapport, building that trust. Good. So I'm going to check her upper neck and see how comfortable she is with extending her pole. Whenever I'm working with these horses, I always just think like they're my own pets. So I want to help them, but I don't want to force them. I want everything to be nice and comfortable. You know, I do a lot of petting, scratching, all that type of stuff, just so that they can trust me and relax for me, so I can adjust them as good as I can. There we go. Got to get that pole nice and loose. Sometimes it's a little bit sensitive, but if you don't get that pole loosened up and moving properly, then everything else is going to be screwed up, because they're going to have so many compensations working down their back just so that they can bring their head left and right and into flexion and extension. And one of the most common things you'll see, especially if a horse's pole or their upper neck is locked up in flexion or extension, is they'll start to get sore in their withers, right? So they'll start to get sore in this area right here, right behind the head, all through here. Because if they can't bring their head up comfortably, they're going to sit back to get those eyes up. Their brain always wants their eyes level with the horizon. It's called the riding reflex. So if their pull isn't working properly and they can't bring their head up comfortably, they're going to sit back, right? So if my head's down here and I sit back, now my eyes are level with the horizon, and that's what they'll do. And because they're using those muscles at the wither so much to get the head up, they're just going to get really, really sore in there due to a buildup of lactic acid. So I always focus on getting that pole moving properly, getting them comfortable to flex and extend, so it takes away that discomfort at the wither. Usually I'll do a follow-up in about 8 weeks or so. Typically horses don't need to be adjusted nearly as often as people, so I'll give them an adjustment and then usually follow up in about 8 weeks. And if they're a performance horse, they'll be on a 8 to 12 week regular schedule. And these horses here, I typically see every 8 weeks, but I haven't seen her for about 3 months or so. All right. So So hopefully you guys saw that, but basically I went to pick up this mare's foot in its shoe. So, you know, if I hadn't come out and checked her, who knows how long she'd have been standing there with the twisted shoe like that, and that would cause a whole bunch of other issues. I start doing adjustments as soon as people want their horses checked. You just have to adjust them differently, right? Because you know the weanlings are very cartilaginous still, so you know you want to keep the adjustments, you know, as small as possible. You don't want to do huge big adjustments on them, but you can do a lot of reflexes, a lot of stretching, a lot of small adjusting. The birth process is super traumatic for these horses, so it's a great thing to get them checked even from birth, just like it's a great thing to get your children checked from birth. So there's no age limit where I start. You can start as soon as they're born, and it's great for them for many reasons. So I'm just stretching out her front legs. The vast majority of the time, the horses absolutely love being stretched out. And I have a stretching program on my website linked in the description. And it's an equine stretching course, and I have 25 different stretches for them. It's about 90 minutes of content. If you have a horse of your own and you want to know how to do any of these stretches, including the pressure points that I've been doing, please check that out. Also, I'm going to be having a live subscription option. I already have it on my TikTok page, where I go and make a more personalized session for my subscribers. So check out my TikTok account. It's also at Sport Horse Chiropractic, and hope you guys will consider joining my subscription. Oh, there we go. Nice little release in the knee there. Good girl. I'm also going to be coming out with a manual, a written manual. So there's going to be a hard copy, and you'll also be able to purchase the manual separately, but that's hopefully by the end of the month. Thank you for the questions, Allison. Appreciate it. Oh, there we go. And you can see how Arizona really loves her stretches. Oh, it's amazing to do this stuff for performance horses, then watch them compete, especially when they're competing against the clock, and you can really see the difference in how you help them improve their times and improve their overall performance. She's a sweetheart. There we go. There we go. Another release in this knee. That's awesome. You guys, thank you so much for the likes. If you haven't hit that like button, please consider doing so. If you haven't subscribed to my channel, I hope you consider doing that as well. Beautiful. Again, my website is sporthorsechiropractic.com. So take a look at that if you want to learn how to stretch your horses. Nice little release in that hip. Oh, good. Very good. Good releases in both hips there. This is just a good stretch for the TMJ, for the pole. Makes them really use their lower jaw and use their tongue, so we get some stretching of the muscles that attach to the hyoid. There you go. Good girl. Makes it easy to check their teeth as well. And the pressure point that I'm using is also on my stretching course on my at sporthorsechiropractic.com. Allison, takes about 6 years. You have to be a human warrior actually already licensed. So it's not a certification program by itself. You have to be a licensed chiropractor or a veterinarian first. And in some states, you can only be a veterinarian. So it really just depends on which state that you're in. And she really needs her teeth done, so I'll pass that along to her owner, just like the twisted shoe issue. She's got pretty sharp points on her lateral incisors. And any issue with the teeth will affect how she takes the bit and the sensitivity of her mouth, so it's very important to get your horse's teeth checked out. All right, she's all set. Thank you guys for tuning into my live. Hope you'll consider subscribing, and if you haven't hit that like button, please consider doing so. I'm going to, but thank you guys again for joining my live.